Hi everyone, I am Noora, now doing fellowship on Strabismus management under Indian Academy of Optometry. All we know what is strabismus or squint. Basically it is misalignment of eyes. Before knowing about misalignment of eyes, we should have an idea about what is the alignment of eyes. Alignment of eyes means visual axis of both eyes are meet at one single point of object. That is called as normal relationship of the eyes, or we can call it as alignment of the eyes. If it is not the case, that means if visual axis of both eyes have abnormal relationship with each other, then one of the visual axis deviate from the object of point. Then we can call it as strabismus or squint or crossed eyes. BSV is the one of the hallmarks of the human race. BSV means binocular single vision. That is the ability to use both eyes together simultaneously. That is one of the hallmarks of the human race, because 60% of the brain tissues and half of the 12 cranial nerves are related with eyes. Then we need perfect sensory and motor control of the both eyes together in rest and eye movement also. Then only we can say that there is a perfect BSV. For this mechanism to occur, we should have two two-dimensional images of an object that should be perceived on the fovea. Then it transmits into visual cortexes. Then that processed into a three-dimensional image having depth perception or stereopsis. Basically, squint can be divided into two types. First one tropia, then second one latent. Tropia means manifest squint. That means when a patient comes into clinic, we can definitely say that patient having squint. Either patient eye may be deviated towards the upper side, down side, or inner side or outer side. Or when a patient having not any manifest squint or any other symptoms, but through different type of test we can identify that patient having some amount of squint. That is called as latent squint or phoria. Okay. Then now we are going to discuss about identification of squint based on direction of deviation. Based on direction of deviation, squint can be divided into horizontal deviation, vertical deviation, then cyclodeviation. In horizontal deviation, again we have esodiviation and exodeviation. First of all, we can say about orthophoric condition or normal condition. Orthophoric condition means patient having not any type of squint. That means patient eye can align with normal position. Here in this case, patient eyes are in primary position having not any type of deviation towards right, left, up, down. That is called as orthophoria. Then horizontal deviation can be again divided into esodiviation and exodeviation. Esodiviation can also called as convergent strabismus. Then here patient eyes are deviated towards inner side. That is the esodiviation. Otherwise, if patient's eyes are deviated outward, then we can call it as exodeviation or divergent strabismus. Okay, that is the horizontal deviation. Then in vertical deviation, there are again two type of deviation, that is hyperdeviation and hypodeviation. In hyperdeviation, eyes are deviated to upper side. Then in hypodeviation, the eyes are deviated towards downside. That is the vertical deviation. In cyclodeviation, the 12 o'clock meridian of the eyes are inverted. That is the encyclodeviation. If 12 o'clock meridian is extorted, then we can call it as excyclodeviation. Okay, next we are going to say about identification of squint based on committancy. Based on committancy, squint can be divided into two types, that is committant deviation and incommittant deviation. In committant squint or concomitant squint, there is equal deviation or equal angle of deviation in all direction of gazes. Okay, when we check angle of deviation in primary position, in dextroversion, dextro elevation, dextro depression, levoversion, levo elevation, levo depression. Okay, in each and every direction of gaze, if angle of deviation is same, then we can call it as committant deviation. Second one is incommittant deviation. That means in each direction of gaze, the angle of deviation is different. That we can call it as incommittant squint or non-committant squint. For example, DRS, that means Duane's retraction syndrome, or Brown syndrome and superior oblique sheath syndrome. All these are examples of concomitant strabismus. Broadly, we can classify concomitant strabismus into two types, that is paralytic strabismus and restrictive strabismus. Next, we are going to discuss about corneal reflex test or Hirschberg test. It is to estimate the ocular deviation. Basically, we are doing on this test is that we are letting a reflex or a torchlight into the patient's eye. By checking the position of corneal reflex, we can estimate the ocular deviation. For example, if there is not any deviation in the patient's eye, the location of corneal reflex or the position of corneal reflex will be symmetrical in both eyes, that is towards the center of pupil. If corneal reflex is in center of pupil in both eyes, then we can say that patient has not any squint in his eyes. Okay. If corneal reflex is at the border of pupil, then we can say that patient has 15 degree of deviation. Okay. We can easily identify this through this demonstration. If corneal reflex is in the center of pupil, then we can say that 0 degree of deviation is there. If corneal reflex is in border of pupil, then there is 15 degree of deviation. If corneal reflex situated in between the border of pupil and limbus, then there is 30 degree of deviation. At last, when there is corneal reflex is at limbus, then there is 45 degree of deviation. If it is in the conjunctiva, then there is 60 degree of deviation. In this test, we ask the patient to look at the pen light. Then we can check the position of corneal reflex. In this patient, the corneal reflex is correct middle of the pupil. That means 0 degree of deviation is there. I think this is clear in this video. In this patient, the position of corneal reflex is in correct center of the pupil. In case if it was in the nasal side, then we can say it as there is exodeviation is there. That means the position of corneal reflex will be opposite to the deviation having for the patient. Okay, now we are going to discuss about cover test. All we know what is cover test. It is a very common procedure that we are doing on our clinic. Cover test is having different purposes. Mainly there are so many types of cover test. Mainly 3 types: cover test, cover uncover test, then alternate cover test. All these 3 have different purposes. First of all, cover test. This is only for tropia, that is for manifest squint. Then cover uncover test means both for tropia and phoria, and for which eye showing squint. At last, alternate cover test only for phoria. Okay, we said that this test can be do at both distance and near. Now we are going to do at near, that is at 33 centimeter. Ask the patient to look at this tip of pen. Then first we are going to do cover test, that is for tropia. In tropia, that is we are doing cover test. First we cover one eye, then check the movement of the uncovered eye. That is when we cover the left eye, we are checking the movement of right eye. Here when I cover the left eye, there is no any movement on the patient's right eye. That's why we can say that patient having not any manifest squint. At first look itself, we can say that there is no manifest squint. Then we did the cover test of left eye by checking the movement of right eye. Here we know movement. In same way, we can do the right cover test by covering the right eye and by checking the movement of left eye. Here patient having not any movement, that is there is no any manifest squint in patient's eye. That is the cover test. Actually we are doing the occlusion by occluder or any other instrument, and it is not professional to use hand palms to cover the one eye. Actually I am not doing this video in clinic, that's why I used my palms for occlusion purpose. Going to discuss about cover uncover test. In cover uncover test, if we are doing cover uncover test for right eye, then we are covering the right eye and it's uncovered and the check the movement of right eye itself. Okay, we covered and then uncovered and check the movement. For example, here we covered the right eye and uncovered, there is no movement, then again covered, uncovered, no movement, then again covered, uncovered, that means no movement is there. Here we have a normal patient. For example, if patient's eyes are moving from inside to outside, then we can say that patient have ESO deviation. Last, we are going to discuss about ACT, that is alternate cover test. It is purely for phoria, that we are alternately covering one eye and next eye, and the speed of occlusion should not be speed, because when we speedily cover the eyes, then the process of fusion will not be break. Okay, our fusion should be break, then only we can check the movements having for the patient. Okay, we slowly cover one eye and then next eye. Then I covered left eye, then right eye, then left eye, then right eye. Okay, when I covered and uncovered, we can smallly detect that there is a small inward movement for the right eye. When I again uncovered the eye, there is a small deviation for left eye also, that is inward deviation is there. Then right eye shows also a inward deviation. That means patient having an exophoria, that is from outside a small movement shows into inner side. In cover test, we can confirm the squint of patient by checking the eye movement. Okay, from inside to outside it is ease of deviation, and from outside to inner side it is exo. Then from to up to down it is hyper deviation, and from downward to upper side it is hypo deviation. Okay, that is the basics. And in this video we discussed about identification of squint based on direction of deviation, then based on competency, and also we discussed corneal reflex test or Hirschberg test by checking the corneal lateral flex. Okay, then at last we discussed about cover test. This is the topics that we covered in this video. I hope this video will be helpful to you to understand about the something about strabismus, and I am really thankful to Indian Academy of Optometry who gave some opportunity to talk something on strabismus on this video.